Hey guys, what's up? It's Mona. So today's YouTube video is obviously going to be a little bit different because there's a lot going on in the world right now and I don't have my usual setup. I usually have professional sound, lights, all of that. So this is just something I shot in my living room. And I really wanted to make this video with a family friend of mine who is an amazing doctor and actually used to work for the CDC. So I thought with everything going on right now, I would make this video to answer some questions that everyone has. Think about what we can do proactively, what the best thing is all of us to do as, a united community across the world. So you're gonna see a Skype interview that we filmed together today. It is a bit pixelated, so I apologize for that. It's the first Skype interview I've done, but I really wanted to bring some valuable content. And I have some YouTube videos that I filmed that will come in the coming weeks, but who knows, some of my videos might be looking like this, so they're gonna be a little more chill and casual. So I hope you guys enjoy this video and get some real value out of it. I please ask that you take the advice of this doctor. You'll see different things that he recommends so that this virus can stop spreading. If you have any more questions, leave it in the comments. And he actually did just start an Instagram account, so I will show him the questions and we can get some more answered. But I hope that this brings you value and a little sense of maybe peace and security in this crazy time we're living in right now. And I love you guys, and I'll see you later. Hey guys, this is a video I'm doing with Dr. Cyrus Shahpur. Hi, Cyrus.
Hi.
So I kind of wrote down like my top 9 questions. The whole point of this interview is to be realistic, but also be proactive because I feel like there's so much scary info out there right now where
Yeah.
we're hearing stats of people dying and how many people are sick and what we shouldn't be doing. And I just want to know, I feel like everyone needs to know from a reliable source, like what we can do to help stop it, right? And like work
Sure.
together.
Yeah, I think so. I think it's important to know what's valid information, what's misinformation, and honestly to acknowledge that we're learning more every hour. So, what we say today might change, but the pace of information is unprecedented. So,
Okay, so I wrote down my questions here. Basically, the first one is I know everyone wants to know what they can do right now in terms of staying healthy. So I've been talking a lot about immune boosting. So does eating healthy, does taking certain supplements, like boosting your immunity, is that going to help you basically fight off any kind of virus, including COVID-19?
yeah, we don't have specific information about whether or not, eating certain foods results in you being protected from COVID-19, but we know that healthy diet and exercise in general helps prevent illness, helps reduce the severity of illness. So I think the smart thing to do is maintain a healthy diet, make sure you exercise. I think in terms of supplementation, there is some evidence that vitamin D can help with respiratory infections.
Okay.
So that's, and there's not too much harm in taking vitamin D supplements or making sure you get sufficient vitamin D from your diet and being outside for a limited amount of time. I think 15 minutes a day is enough, depending on how dark your skin is. But especially if you're deficient in vitamin D, that's one thing you can do is just make sure that you supplement yourself. Vitamin D might have a role in the seasonality of influenza and TB, meaning people are inside in the winter, so they're
Mhm.
not getting that exposure, and that might play a role in those diseases. So that's something that could work in in terms of a specific thing that you can do. But in general, just healthy diet and exercise.
What dose? Because I know everyone's gonna want to know exactly what dose, how many times a day. So like what would be recommended?
Yeah, the dose varies. Recommended dose varies by age and some other factors, like if you're breastfeeding and things like that.
Mhm.
So I can't tell you all the doses for all the ages, but it's
Okay.
easy to find online.
To just go to something
And I
on.
can send you a link too.
Okay, maybe I'll link below this video what people can go and look up depending on their. Of course, everyone has specific situations, but
Yeah.
we can do a general link.
Yeah, and just to say, vitamin D, you can overdose on this vitamin.
Mhm.
It's very rare, but just that's something that you need to consider, and it can also interact with other medicines. So just make sure if you're taking other medicines, like prescription medications, that you look at that. And then for people who want to go check their vitamin D level, just recognize that oftentimes this isn't covered by insurance, and it's very expensive.
Right, and
So
especially now is not the time to really be like going out and getting blood
exactly.
tests. Right, it's not necessary. So I actually think right now too, people are so panicked that anything you suggest, they're gonna do 10 times, like tenfold, right? So like
Not
vitamin D, I'm gonna like take triple the dose. So that's not always a good thing. So I think that's a good point to make.
always a good thing.
Right.
Yeah.
Usually not a good thing, actually. Okay, so the next question I had was the virus on surfaces. So,
Yeah.
I mean, there's so many like funny videos of people like not touching boxes with gloves and like, obviously wiping things down. Like I had to run to the pharmacy to get some stuff and like I was wiping down every surface. Like how careful do we have to be? Like if I'm ordering something on Amazon, is there really a good chance that an Amazon worker could have had it and then I could be touching the box and I could get it?
Well, we know most of the transmission is not via contact transmission. It's via human-to-human respiratory droplet. We don't know how much of it is contact transmission yet. We do know the virus can survive on surfaces, and so there was actually a study a few days ago in the New England Journal of Medicine looking at how long the virus survives on different surface types. It was 4 hours for copper, 24 hours for cardboard, and 2 to 3 days for plastic and metal, stainless steel. So you can see it varies a lot by the surface. I think the thing with boxes and things like that that come to your house is just to make sure that that if you pick it up, that when you after you open it, you wash your hands,
Right.
and then get rid of the box. So I think it's okay to still deliver packages because that's honestly how we're getting a lot of the essential things we need now if they have it in stock. So I don't think there's evidence that this is a significant problem. And just like you would touch anything else when you're outside of your house, for instance, you need to just make sure that you maintain good hand hygiene. But again, this is a very small component. We don't have great proof about contact transmission rates. We just know it survives on surfaces, so it makes sense that we want to just be sure that we're careful around touching surfaces.
Okay, but at least like I just want to at least stop some of the like complete paranoia. Like be careful, but don't be so worried about the surfaces is the least like issue.
Yeah, I mean it's a component.
Right.
Like in cruise ships, we've seen a lot of spread, and one of the reasons why might be that they have a lot of surfaces that a lot of people touch in cruise ships. It also might be that they're very close together. But as I said, it's not the major way this virus is transmitted,
Okay.
as far as we know.
Good to know. So who we can see.
Yeah.
Obviously, it's supposed to be social distancing. So actually, personal story, my mom lives 3 hours away. I'm in New York City. She works at a hospital and she works in IT. And she was going to come visit this weekend. And I'm like nervous because she's in a hospital. So like that might be an extreme case, but let's say, my uncle lives like an hour away. Should we even stay away from visiting other households in general? Or like how far should we take this in terms of social distancing?
Yeah, the safest thing to do is just take it pretty far. The
Okay.
virus doesn't know if people are your friends or family, and oftentimes we don't know what the behaviors are of these people outside of when we see them. I mean, we trust friends and family, depending on our interactions with them and if they're following, say, physical social distancing. But we don't know if they're out in the community the rest of the time, or especially people who are healthcare workers have a higher risk. So there's a higher risk of them having infection than others. So the safest thing to do, to be honest, is just avoid seeing other people. Essentially, I know you can't avoid people in your household, but
Right.
outside of that, especially people in vulnerable groups. So this is people 60 and older, or people with underlying conditions or immune system problems.
Yeah, I mean, I wish my mom could work from home because she's over 60 and she works
Yeah.
in IT, so it's not like she asked and her hospital won't let her. It's super frustrating. I'm like, she could easily do her
That's
job
interesting because IT is generally something you would think you could work from home. Yeah.
easily. I mean, she's come to visit me before and she's working on her laptop, so there's no reason why she shouldn't. And then like doctors want to come ask her a question, so they're coming to her office. So she's just I don't think it's safe, but maybe
Yeah.
maybe something will pass soon. So tests are like being developed faster than obviously a treatment or a vaccine.
Yeah.
My question is, will more tests really do anything? Because it's not helping the spread. It's just knowing people have it. So is it just that now we know the people who have it have to stay home? Like, how is it going to help?
Yeah, I mean, testing is valuable. The problem we have is access to testing in the United States, but testing is valuable to get a complete picture of who has it, who might have it that is not symptomatic. So the proportion of people that are carrying it around without knowing.
Well, that's my
And also,
then are people going to, is everyone just going to test who's asymptomatic? Because that's kind of what my point, like,
there's been different approaches around the world. In Korea, they have widespread testing, hundreds of thousands of tests, and they're testing people who aren't symptomatic. There's a small town in Italy that decided to test everybody in the town. And so they did that twice, and they were able to get the cases down to zero. So
wow.
it can affect spread because, say a nursing home facility or a long-term care facility that has a lot of vulnerable people. testing would be important there to prevent, say, workers from going in or other residents from, who we might not know have it. If we find out they have it, they need to be separated from the people who are well as soon as possible. So there is a role for testing in terms of protecting people and reducing spread. Unfortunately, right now we have limited tests, so we need to prioritize who we test, and that's vulnerable people, healthcare workers, and those kinds of people.
Realistically, like, what are the numbers of tests? Like, are they actually coming? Like, what's happening?
Yeah, I know we've heard a lot about the testing problems in the United States. It's a mixture of factors that related to that. I think there have been improvements recently, and to be honest, the biggest sign that we have better testing is the increase in the number of cases that you see in the United States. So you're seeing cases go from hundreds to thousands. We'll see them go to tens of thousands, hundreds of thousands potentially. And as that happens, it's because we've rolled out testing, because the more we test, the more we're going to find cases.
That's a good point. Which also kind of makes me wonder, like, I know we're talking about the death rate, but wouldn't the percentage technically be a little better because there's more people who have it? So it's,
Yeah. Yeah, globally it's about 4%. So about 1 in every 25 people right now who've had it that we've identified that have it have died. But we know that number that we've identified is low compared to everybody who actually has it. There's people who have mild cases that we're missing, that we're not detecting. So that 4%, if you account for all the people that we missed or we're not testing, goes down to about, we think, 0.7% rather than 4. But it's still, a lot higher than seasonal flu. So it is still more severe even after accounting for all of that.
It is still more severe. Okay. I think
Yeah.
that's an important point because so many people are like, it's just like the flu. It's just like the flu. First, and for some people, like Tom Hanks, you might have mild symptoms, but it doesn't mean everyone does.
Right. Most people will have mild symptoms, about 4 out of every 5, but 1 in 5 will have severe or critical symptoms that require hospitalization or critical care.
Let's say like someone who's 32 has flu-like symptoms, but they're not at risk and whatever, and they don't test. All the test is going to do is basically tell you to stay home, right? There's no treatment you're going to get. You're only going to go to the hospital if you physically need to, like you can't breathe and you need to be on a respirator or something, right?
Yeah, if you're symptomatic. It depends how bad your symptoms are. So
Okay.
if you get tested, it's going to tell you if you have it, you should stay home, but you should also separate yourselves from vulnerable people, even if they are in your household. So if I live with my grandparents and then I test positive, I need to figure out a way not to be around them,
Right.
in terms of protecting them.
Everyone's kind of buzzing around that it's supposed to slow down in April, May, this summer, and then come back in the fall. Is,
Mhm.
is that the truth?
We don't know.
Okay.
Nobody knows. This is a brand new virus. We see this happen in other viruses like seasonal flu, and some coronaviruses that cause the common cold, but this is a brand new virus and we don't know. Usually there's a few factors that relate to things going away in the summer, for example. One is the environment. These viruses tend to favor dry, cold air, so as it gets warmer and more humid in some areas of the world, you can see decreased transmission. Human behavior when it's warmer, like we go outside more, so we're not inside close together as much because it's warm outside and people are separated a little bit more. And also schools are on vacation. Yeah, and
Yeah.
schools are on vacation, so the schools are closed, generally. Like we've closed them now, but in the summer there's really no school. And then the immune system could be, worse in winter. Things related to, say, vitamin D, for example, not getting sun exposure. So those factors play into, why we see a decline sometimes in the summer, but we don't know about this virus. And most experts would say we might see a decline, a small decline, but it's not really going to go away, completely. So we're not planning for that. We're planning for it to continue.
Right, because they can't tell if it's actually going to. Are we going to be quarantined for 12 months? Like, we don't even.
I'd say it's a potential. It's on the table. It could happen.
Like
I think.
at this status, or like a little like more mild.
Yeah, I think the problem is that we're at an extreme level of community mitigation. So essentially, we're doing things like shutting down, the economy. We're closing restaurants, and basically everybody's at home. And how long can we really do this for? It's very difficult. So we don't know because we haven't done this in over 100 years, essentially. I think one of the strategies that's being looked at now is if we do it right now for a period of time until we see the cases go down, can we turn all of that off for a while until the hospitals get full again, and then we turn it on again? And then as we treat cases, it goes down again. And then we turn it off, and then we turn it on again. So it could be this kind of intermittent sprints You might consider it like that. That might make it more feasible to do this kind of control over the long term. And really, we're just waiting for effective treatments and vaccine. So if effective treatments come earlier, then that's a game changer. If the vaccine is developed earlier, which is very unlikely because of the amount of time you need to do safety trials and things like that, then that'll change things too. But right now, it's all about spreading out infection and hopefully minimizing the number of people that get infected until we have those things.
So one question, if you
Yeah.
find out that you do have the virus, do you need to throw away things you've touched, your makeup, all the food in your house, all that? Like, what happens there?
I think it depends. For items that are shared,
Mm-hmm.
and there's people that you're sharing them with that aren't infected, then I think you need to, yeah, get rid of them because it could be a potential source of transmission. Either you get rid of them or you could wait a long time. We don't know how long.
Touching it, that's true.
Yeah, we know plastic and steel, for example, were 2 to 3 days, right? But we don't know every surface type, how long it survives on different household items and things like that. But theoretically, it should go away after a certain period of time in terms of being infectious on a surface. But the safest thing to do, especially for shared items, is to essentially get rid of them.
Next question. If one person gets it in the house and you're living with like your brother and your parents or your sister, or your husband, like that you can't quarantine anywhere else, like you have nowhere to go. So do you just kind of have to assume the other person's going to get it? Or should the other person, is there even a point in trying to like cover their mouth and nose and eyes for 14 days?
Yeah, I think it's important because if you're over 60, the rates of death are between 1 in 100 to 1 in 7. So really, you're just trying to save the people you're living with by helping them not get infected. So as much as possible, you need to continue trying to avoid coughing or sneezing in front of them, maintaining separate kind of living areas, that kind of thing. The likelihood of getting it from somebody in your household really is about how much you interact with them, how much you're touching the same surfaces might be a small part of that. And even if you have it and you have nowhere to go, I think you really need to do everything you can to protect other people in the household because this can be, deadly.
One thing I heard was that people with type A are more vulnerable to corona.
I haven't seen that.
Okay.
I don't know about that.
I was curious if like people that have type A blood, I mean, everyone should be as careful as possible right now anyway. I guess it doesn't matter.
Yeah.
Okay.
Yeah.
So question, what are the top 3 things people should be doing right now to stop?
Sure. Yeah, I think the first thing is to prevent themselves from getting infected. So this is observing whatever the local situation, the local guidance is on physical distancing. I think we try to use physical distancing rather than social distancing because social distancing, makes one think of being isolated. We're really talking about staying away from people. So physical distancing, especially if you're not feeling well. If you're feeling sick, then you shouldn't be out and about. And even if you're feeling well, you shouldn't be around other people as in close contact if you don't know what their risk level is. And then the other part of that is staying healthy. As we talked about earlier, staying healthy, having a good diet, exercise, all the things you can do to prevent yourself from getting infected. The second thing you can do is prevent yourself from infecting other people. So this is about, again, physical distancing, not going to social gatherings, because you could spread this even if you're feeling fine. So that's why it's important to maintain that distance with others. And then the last thing is taking care of yourself, emotionally, mentally. Use this as an opportunity to do home projects, read the book you never got a chance to read, those kinds of things, and really maintain the social networks. That's important as well. I've seen some creative ways to do that with like virtual happy hours or other things, but really stay connected rather than just being a hermit and not talking to anybody. Yeah. Thankfully, we live in an age where we have FaceTime and other things. And so it's easier to stay connected, and it's important to do that because other people are going through the same thing you are. Right. And it's important to stay connected to be resilient, and I think that's important as well. So those are the 3 things: protect yourself, protect others from getting infected from you, and then taking care of yourself.
And I just want people, I know we're frozen right now, but I'm going to keep talking. At least people will have the voice.
Yeah.
I just want people to hear this because I know there's a lot of like, this is like exaggerated. This is like mass hysteria. This isn't real. And I feel like, you're not in politics. You're not in the government. You're a doctor. So, I think people need to hear from like a sound source that this really is real and all of this is important because I'm in New York City and I was going to try to run to the grocery store this morning, the first time I've stepped outside in like 7 days. And there's people
Wow.
like walking around with like, no gloves, no scarf, just like doing their thing. It's still not that serious here.
Yeah, I think unfortunately, I think people start to take advice into account when they perceive the risk to be high to them. So when they start seeing people dying at a high rate, when the case counts in an area go up, then people start to change their behaviors. But right now, it's highly variable in the United States in terms of people complying with things. We see people in spring break in Florida, saying, if I get corona, I get corona, right? But that's because they're not perceiving this as a risk to themselves. And unfortunately, you can look across the pond at Italy and see what's going on with a person dying every 3 minutes and know that this can get pretty severe. So hopefully people will change their behaviors before they get affected personally.
Right. Okay. So I guess we've talked about a lot of the prevention, and then my last question is, if you had to predict in terms of like treatment, is treatment versus vaccine, like how is that different? Do you think something is coming relatively soon? I know vaccine is going to take a while, but what about
Yeah.
treatment?
Yeah, treatment, I think the good news is we have millions of people around the world focused on treatment, and a lot of groups working on different treatments that might be available, evaluating them, doing clinical trials. We're starting to see early information from those trials even this week.
Okay.
And you see the president recommend 2 drugs that, for expanded use and potentially more study in terms of whether or not they work. We don't have big evidence that they'll work right now, but we're investigating it. So I think treatments are around the corner in the sense of months. Within 1 to 2 months, we should have results of the treatment trials. And if anything works, that's great. Then we just need to mass produce and get it out there. And it depends how effective the treatment is. Is it mildly effective? Is it, really effective? That'll have an impact on the overall situation.
And I guess treatment, I guess the difference is like vaccine will stop you from getting it versus
Yeah.
treatment, like you're still going to get it. It's just a shorter duration of how long you're sick.
Yeah, it depends. Treatment can be used to shorten the duration. It can be used to shorten the to reduce the severity, kind of like Tamiflu with influenza.
Mm-hmm.
Um, but it can also be used potentially as prophylaxis, so it can be used to prevent. So there's different options there. We just need to get good candidates.
And is everyone in the world working together? Like, is this a collaborative effect? Like, is the US talking to Australia and talking to India, or are we all just kind of doing our own thing?
I think we're learning from each other.
Okay.
Experience in China happened first in January, February, and there was a lot of information there. So hopefully we're building on their experience as they share their science.
Okay.
And then we're in a different wave, and different countries are in different waves of illness. There are more trials that are multi-country, so working together. But hopefully we're all building on top of something to get to the destination, which is an effective treatment.
Okay. Okay, good. Okay, well, thank you so much for doing this interview. I
Sure.
think it's such a good, reliable source. Where can you just started an Instagram account, right?
Yeah.
Yeah. Okay, we need more of your like actual, real, updated facts on there. So I'll pop that up on the screen, and everyone can follow you.
Great.
Okay. Thank you so
Sounds good.
much.
Okay.
All right. I'll talk to you later.
Okay. Bye-bye.